Well, what I would like to do next is to follow up a little bit on the broadcast that we presented last Friday. As most of our viewers know, we presented a dramatic picture of the collapse of the United States economy under the past 5 years of the Obama administration. We used charts, maps, a series of graphics to demonstrate this case. Now, very interestingly, this Wednesday, a hearing was held in the United States Senate that really served to complement the picture that we presented last Friday. It was a hearing that was sponsored, interestingly, by Senators Elizabeth Warren and Bernie Sanders. And the hearing was called Dying Young: Why Your Social and Economic Status May Be a Death Sentence in America. And through a series of graphs, the witnesses demonstrated how the economic policies of the recent administrations, both the Obama and the Bush administrations, are causing Americans to live far sicker lives and to die far earlier deaths than we previously did. And for the first time in our country, we can expect to die, on average, earlier than our parents did. Mortality rates have actually increased for many areas of the country, and life expectancy has plummeted. One witness showed that in just in the span of 14 years, life expectancy for women fell in 43% of the counties of the United States. Almost half of the counties of the United States show a declining life expectancy for women. Also, if you look at the discrepancy between the counties, between even neighboring counties, even counties within one metropolitan area, if you look at the discrepancy between the maximum life expectancy and the minimum life expectancy, you see that the gap between the average maximum and the average minimums is growing rapidly. For women, the gap in life expectancy goes from the longest on average, which is 85 years of age in Marin County, California, and to the shortest at 73 years of age in Perry County, Kentucky. That gap has grown to a difference of 12 years, depending on which county you live in. And then for men, it's even more dramatic. The highest life expectancy for men is 82 years, right here in Fairfax County in Northern Virginia. And the lowest is 64 years in McDowell County, West Virginia. That's a gap of 18 years, almost an entire generation. In fact, the witnesses presented the case that if you look in McDowell County, this county in West Virginia, life expectancy for men is actually equivalent to Botswana and Namibia, two of the poorest countries in sub-Saharan Africa. And then if you look at the women in McDowell County, West Virginia, the women die younger on average than the women in El Salvador and in Mongolia. So you can also take certain neighborhoods, maybe not necessarily counties per se, but if you take certain neighborhoods in Boston and in Baltimore, you'll find that the people who live there have a lower life expectancy than many of the nations in the third world, including Ethiopia and Sudan. These are neighborhoods in two of the biggest cities on the East Coast, Boston and in Baltimore, and the life expectancy there is equivalent to Ethiopia and Sudan. And then the rate of premature births, premature infants, for the United States generally, is equivalent to many of the countries in sub-Saharan Africa. And the infant mortality rate in the United States is higher than many nations in the third world. So this is the picture that was presented. One of the witnesses, a fellow named Professor Michael LaRouche, who was from the University of Maryland, showed that just in the past 2 years, between 2010 and 2012, so that's right in the middle of the Obama administration, just in that 2-year span, the number of people officially living below the poverty line in the United States has increased by 3 million people. That brings the total to 50 million people in the United States who are officially poor. That's the largest number of people in poverty since we first started measuring those numbers, and it's the highest rate of poverty per total population in over a generation. And what he said is that the official poverty rate is 16%. That's 16% of the U.S. population living beneath the official poverty line, which is calculated at $23,000 a year for a family of 4. But he stressed that this percentage is probably underestimated by half, if not more, because it excludes homeless, it excludes incarcerated, it excludes those who are forced to move back in with their families. It fails to take into consideration the fact that the cost of living in many metropolitan areas is far higher than is estimated. He said 3/4 of all Americans, 75% of all Americans, have incomes below $50,000 a year, which is considerably below what it takes to live even a minimally decent life in a major U.S. city. And this has not been readjusted since they first started calculating the poverty level index. So if you raised the poverty level index by just 10%, which would be appropriate, he shows that 1/3 of the entire U.S. population would be officially poor. So what was presented by the testimony at this hearing is that if you directly correlate poverty with life expectancy, the increasing poverty over the last 3 administrations can be directly correlated with decreasing life expectancy in the United States. So to say that the policies of the Obama administration are murderous is not an exaggeration at all. And while you have had poverty increasing in the Obama administration, as we demonstrated last week with our series of charts, along with a collapsing rate of employment, a rising dependency on food stamps, an increasing inflation in the price of basic necessary goods, and the systematic elimination of critical medical care, now you have parts of the United States of America beginning to resemble the most desperate nations in sub-Saharan Africa. And we know very well that the genocide we've witnessed in Africa for generations has been the result of the policies of the British Empire. And now Obama is bringing those policies right here to the United States. So I want to give you a chance to speak on that.
Well, there are several things that are of cardinal interest in this process. First of all, we have to, in order to understand U.S. policy respecting our own population, we have to look at the Queen. What's the policy? Now, the question that we're on the verge of celebrating the mass of our former president, and why was he killed, and why was his brother killed? I think that my view on this matter is by no means extraordinary, but rather accurate. The policy of the Queen has been openly, in more recent times, a policy of reducing the human population of the planet to 1 billion people from 7. That has been her policy. It was the Copenhagen policy she announced then. It was repeated all over the place. But we know the policy was earlier. What was the effect? The effect of the assassination of John F. Kennedy was that the result was a war in Indochina which decimated, for a period of at least 10 years span, decimated the population of the United States in a cruel way. This was associated with the introduction of a massive drug addiction policy. So what we had is, with the onset of the assassination of President Kennedy and then his brother Robert, what we've had is a trend of decline of the living standard of the U.S. population. This has been aggravated by things such as the drug program. Now, the drug program has been the biggest factor in destruction of the minds and health of the people of the United States. This has been a trend ever since. Now, the idea that the policy, the green policy, is also a genocide policy. If you try to apply the green policy to the population which existed prior to the assassination of John F. Kennedy, you realize that this policy, the drug policy, which was instituted voluntarily as part of this policy, and the reduction of the quality of life in general during the virtual decade from the advent of the war in Indochina, you see a pattern of legitimate, or actually legalized, genocide against the U.S. population. And if you look carefully, that has been the trend ever since. Now, one of the dirty tricks was to reduce the productivity of the population by what? By promoting the drug policy. Now, the drug policy in Indochina, which spread back into the United States, has been one of the principal reasons for the collapse of the standard of living of the people of the United States. But look against a background. The background is the Queen of England's policy. And her policy of genocide is the reduction, the stated intention of that queen is the reduction of the human population from 7 billion people to 1 at a rapid rate. The drug policies, the similar other kinds of policies which we see in the United States, we see in Europe and so forth, these policies, while lowering the standard of living, the standard of nutrition, as well as the standard of living generally, this is reducing the population of the planet, especially in the transatlantic region. Now, the significance of the transatlantic region, it was generally the highest income bracket in the world. So what they did is they went at that first, and now the attack on India and China most conspicuously, is now a target. In other words, we're at a point where, under present policies, where China had been increasing its productivity, they're now in the process of having it sunk because of the cutting off of the market for goods which are produced in China and so forth. So what we're dealing with, we're not dealing with some little problem, some piece of negligence. We're dealing with something, the oligarchical system. If you look in the history of mankind, the oligarchy has always pulled such tricks. But it never had the kind of technology before which would enable it to do it on such a broad international scale. So this is not a problem which has been neglected. This is an effect which has been intended. And you look at what's Wall Street, for example. What is Wall Street? Wall Street is typical of the forces which are actually causing the collapse of employment, causing the decline of the income standards. of the healthcare standards, the nutritional standards. This is systemic murder, mass murder, intended on a global scale. And this is the crime against which we have to fight. This is the enemy. Wall Street and what it represents typifies the enemy of mankind. What you have in Britain, Europe, so forth, the same thing. This policy is a policy of genocide. And it's done with things like Wall Street, with the financial system, with the financial gambling system. And therefore, this is going to be a tough fight, because we're going to have to, are morally compelled to crush the policies of the Queen of England and her Dutch partners and other people who have pursued the same policies. We must crush this policy. It's crushing us. Look at the situation in Portugal. Look at the situation in Spain. Look at the situation in Italy. Look at the situation in Greece and Europe. What is this? This is genocide. It's voluntary. The policies that are causing this are intentional. They're led in Europe by the British monarchy and the Dutch system. They're being led in the United States. People the food policy now is actually causing a collapse of the income per capita of our people. Look at the expenses. Look at the prices, the inflation that's going on under this Wall Street system of speculation. This is what's destroying our people. But this is not this thing that's causing the problem. The thing has a human motive. And the human motive represents the oligarchical system, of which the Queen of England is merely a leading example. But this has always been the case. Mankind has always been in a struggle, as far as we know, because we have a human species which has certain qualities, excellent qualities. The human mind is the greatest thing that on this planet. There's nothing on this planet living which can match the potential of the human mind. But that's being destroyed. It's been destroyed before. The Roman Empire did it. What was done in the city of Troy was the same kind of thing. It was genocide. And the genocide is the characteristic of the oligarchical system. The Queen and her Dutch partners are representatives of the oligarchical system. And we founded the United States, essentially is back in the earlier period, the Massachusetts Bay Colony, under the influence of the great Nicholas of Cusa. And Nicholas of Cusa proposed and initiated the program to move people out of Europe and move them across the ocean waters, to areas on the other side where they might be freed to develop their powers away from the victimization by the oligarchical system. Our United States has been destroyed again and again by having bad presidents or killing good presidents. And there were a number of good presidents who were killed, murdered. Other people who were murdered. Why? By the oligarchical system. What has controlled our banking system in the United States? Well, the banking system in the United States has been largely controlled from London. It's been controlled by British banks, which settled around Boston and settled around New York City. They organized this system to destroy our United States. And they did a fairly systematically good job, shall we say. So the point is, let's not assume that there are conditions which are being neglected, which cause these problems, these statistical phenomena. What causes this is the intention of the oligarchical system, which is still a dominant feature in civilization from the top down. And the Queen of England and her Dutch partners are the typification of that evil. And once we understand that what the evil is and who it is, we understand what the Roman Empire was, why it killed people the way it did, why this has been going on around the planet again and again and again. The oligarchical system and the struggle of mankind is against the oligarchical system. We talk about conditions which we wish to remedy. But what are the conditions that we have to remedy? They're the conditions that are induced by the oligarchical system and its legacy. And so therefore, don't say somebody is being bad when they are actually engaged as accomplices in intentional mass murder.